Hi all, welcome to EduWizz Learning app. It's an online application program which helps the nurses who are preparing for Gulf countries to achieve licensed nursing exams. It is an online application program which includes 35 hours of theory classes, study materials, mock test, video discussion classes, and many other features. To know more about our application, please contact us. This is a demonstration class to show you how we conduct the classes inside our app. Okay, so let's see the topic. It is disseminated intravascular coagulation. So, what is disseminated intravascular coagulation? What are its symptoms, causes, and management? These are the points which we are going to discuss today. So, disseminated intravascular coagulation. What is the meaning of disseminated intravascular coagulation? Disseminated means widespread. Okay, disseminated means widespread. Intravascular coagulation, you know that there is clotting inside blood vessels. So, that is disseminated intravascular coagulation. How does this occurs? It occurs as a result of hyperactivity or overaction of proteins that helps in clotting. So, whenever an injury occurs, the clotting factors, the proteins which help in the clotting function, enters the injured site and forms the clot and thereby control the bleeding. But in DIC or disseminated intravascular coagulation, what happens is that these proteins which helps in clotting, so clotting becomes overactive, and as a result large clots are formed. Because of these large clots, the circulation to the tissues will be diminished, which causing tissue ischemia and hypoxia, and lately resulting in organ failure. So, I will tell you three important points regarding DIC. First thing is it occurs due to the overactivity of proteins which helps in clotting function. Okay. Second thing, it does not, disseminated intravascular coagulation does not occur by its own. It always have an underlying risk factor or cause. So, it is important for a nurse to identify that risk factor and to correct it immediately to prevent complications of DIC. So, that is the second point, it does not happen on its own. So, the third one is, just like I said, we have to identify the risk factor and correct it immediately. Let's see in detail about this disseminated intravascular coagulation. As I said, what happens when an injury occurs, the clotting factors, the protein which helps in clotting reaches the injured site and forms the clot. But here, as the proteins are overactive, large clots are formed all over the blood vessels, which results in tissue ischemia and lately organ failure. Now, lately what happens is as the body utilizes all the clotting factors including platelets for this clot formation at the injured site, gradually the platelet levels in the body will be decreased, which in turn results in hemorrhage or bleeding. This is known as disseminated intravascular coagulation. Now, let's see in details. A serious disorder in which the proteins that control blood clotting become overactive. When you are injured, proteins in the blood that form blood clots travel to the injury site to help stop bleeding. This is usually happens. But if these proteins become abnormally active throughout the body, you could develop DIC. So, it is a serious condition if not early identified or treated. So, let us see what are the things which happen when DIC occurs, and or what are the things which occur when these clotting factors become overactive. Okay. So, first thing, the clotting cascades are triggered. Okay. So, clotting factors are triggered and becomes overactive, which causes decreased blood flow to the tissues and organs, leading to tissue hypoxia and lately organ failure. And as body use all the platelets and clotting factors, which ultimately results in hemorrhage. So, this is the pathophysiology of DIC. In short, clotting cascades are triggered and they travel to the injured site and forms large clot, which results in tissue hypoxia and organ failure. And because the body uses all platelets and clotting factors for this issue, all the platelet level in the body becomes decreased, which results in hemorrhage. Okay. Now, as I said, there are always some underlying factors or risk factors which causes this disseminated intravascular coagulation. Let's see what are the common risk factors. First one is trauma, vascular aneurysm, malignancy, pancreatitis, infection or sepsis, severe liver failure, pregnancy complications. This is a mostly asked scenario regarding disseminated intravascular coagulation. Pregnancy complications such as preeclampsia, placenta previa, and abruptio placenta. And other risk factors are blood transfusion reaction and transplant rejection. So these are the risk factors of disseminated intravascular coagulation. So that is why I said there always is an underlying factor, and our responsibility to identify these underlying factors and correct it. Okay. So what are the clinical features that occurs in disseminated intravascular coagulation? As I said, what happens as the body uses all the platelets and clotting factors, ultimately it results in bleeding. So mostly the symptoms will be related to bleeding. So uncontrolled bleeding, bruising, purpura, petechiae and ecchymosis, presence of occult blood in excretions such as stool, hematuria, hematemesis, vaginal bleeding, all these are symptoms of bleeding, right? Everywhere there will be symptoms of bleeding. There will be discolorations like ecchymosis, petechiae and purpura, or there will be bleeding, vaginal bleeding, occult blood in the stool and uncontrolled bleeding. These are the symptoms, and patient will have another symptom which is dyspnea. Due to tissue hypoxia, patient might develop dyspnea. Okay, so complications are because of this bleeding and excessive blood loss. There are three complications, which is stroke, hemorrhagic stroke might occur, or ischemic stroke can also be occur because of this large clot formation. Second is shock because of excessive bleeding. Hypovolemic shock might occur because of excess bleeding, and stroke might occur because of excess bleeding, rupture of the blood vessels, or because of this large clot formation. So ischemic or hemorrhagic stroke might occur. So in diagnosis, all these clotting and bleeding tests are checked, like complete blood count, partial thromboplastin time, PT or prothrombin time, fibrinogen test and D-dimer test. All these tests are done. All these tests will be elevated. There will be elevated levels of all these factors. Okay, PTT, prothrombin time, fibrinogen and D-dimer test. All tests will be elevated in DIC. And treatment includes, as the body is lacking clotting factors. So firstly, we give fresh frozen plasma to infuse the clotting factors. So FFP transfusions to replace blood clotting factors, transfusions of RBC or platelets, IV fluids and antibiotics for infection. Anticoagulant medications are a little bit controversial as there are the chances of bleeding. So anticoagulants might increase the chances of bleeding. So mostly what we give is fresh frozen plasma to replace the clotting factors, and RBC and platelet transfusions, antibiotics for sepsis in case of sepsis, and IV fluids. So these are the treatment of DIC. Now coming to nursing interventions, as I said, the most important feature is to identify and treat the underlying cause. And we will do the basic initial assessments, as this might lead to severe complications such as shock, excessive bleeding and stroke. We have to assess level of consciousness and respiratory and neurostatus. Okay, so we will assess GCS to assess level of consciousness and neurovascular assessment. And secondly, monitor color and temperature of the extremities to see whether there are any signs of decreased blood flow or excessive bleeding. Monitor vital signs and lab values, and monitor urine output because it might lead to renal failure. This is also an important complication of disseminated intravascular coagulation. So these are the important features of DIC. So I will repeat in short all these things. So DIC means disseminated intravascular coagulation, which means there is widespread clotting in the blood vessels. How does this occur? Because of the overactivity of the proteins which helps in clotting. So whenever an injury occurs, these proteins become overactive, and as a result they form large clots everywhere in the blood vessels, which results in tissue ischemia and organ failure. So as the body uses all these clotting factors including platelets, it results in hemorrhage lately. So this is DIC, and the most important thing regarding the management and nursing intervention is it always has an underlying risk factor. So our responsibility to identify this risk factor and correct it as soon as possible to prevent the complications like shock, stroke and excessive bleeding. Okay, the clinical features are mostly related to bleeding only, like uncontrolled bleeding, petechiae, purpura, ecchymosis, etc. And there might be stool in the blood as well and causes vaginal bleeding. So all to hematuria like that, all together, the basic symptoms of DIC is related to bleeding. So we have to assess the signs of bleeding as it can cause respiratory status and neurosystem. Also, we have to monitor level of consciousness and respiratory status. We have to monitor lab values as well. And another complication that might occur in DIC is renal failure. So we have to monitor urine output. All these are the important nursing interventions. And coming to the treatment, because the body is lacking clotting factors, we replace it with fresh frozen plasma or by blood transfusion. And in case of sepsis or infection, we give IV antibiotics and also we give IV fluids. So I hope you understood about this topic. This is very important. Mostly in coming to the risk factors, the question comes related to pregnancy because that is one of the most important cause. Pregnancy complications like preeclampsia, abruptio placenta and placenta previa. And another important risk factors are trauma, malignancy, infection, liver or pancreatic failure, okay, blood transfusion reaction, etc. So these are the risk factors of DIC. So I hope you understood the topic well. Thank you.